patient surgeries regularly, there is a confusion whether to do single knee or both knees in a single sitting. So I just want to shed some light on this topic. So now many of the patients which we are operating, many of them have problem in the opposite contralateral knee also, and these patients, they usually get the second knee done within 1 year. So the bilateral knee replacements in India, they are more nowadays done in a single anesthesia setting. That is because the patient wants it. They are younger, healthier, they want to live an active, healthy life, and because of advances in anesthesia and surgery and perioperative care, we can well manage bilateral knee surgery in these patients. The supporters, they point out the low complication rate, high patient satisfaction and cost effectiveness of the surgery, while there are some surgeons and authors who believe that bilateral TKR should be done in a staged manner because it is associated with decreased morbidity, and in light of the divided opinions, thorough patient selection, it seems to be the safest clinical approach. Now, let's move forward. Now, what are the advantages of a single stage bilateral TKR? There is only one anesthetic session, so the patient is more comfortable because second exposure to drugs, procedures and invasive lines is avoided. Surgical time is shorter. The total surgical time in staged bilateral TKR, it is more than the surgical time when we do in a single stage sitting. So because of this, there is less risk of nerve palsy, vascular injury, muscle damage, post-operative swelling and stiffness. So this leads to early clinical recovery of the patient, and patient is more satisfied. And because of this, the pain medications, we have to use lesser pain medications in single stage bilateral TKR. Also, because of this, the hospitalization is less, and because of less hospitalization duration, the cost is reduced. It is almost 18 to 58% reduced cost compared to the staged bilateral TKR. Excellent clinical result and patient satisfaction. So the range of motion, Oxford knee score, knee society score, and the survivorship at 7 years and 10 years, they are almost comparable or better in case of single stage bilateral TKR. And this is very important, the alignment of both the knees, they become normal in one stage. So there is no limb length discrepancy, and the patient walks with a normal gait. Whenever the complete recovery takes place like 6 to 8 weeks time. But now there are some concerns also with the single stage bilateral TKR. There are some concerns with the complications. There are some concerns with the modalities. So we need to see whether the patient is like, we can go ahead with the single stage bilateral TKR. So what are these complications? There is increased cardiac complications. The myocardial ischemia, it is found to be 4 to 6 times more frequent in single stage bilateral TKR, and it is especially found in patients with medical complications like pulmonary hypertension, congestive heart failure, chronic pulmonary disease, and renal disease. So the patients with reduced end organ reserve, they are at more risk of cardiac complications. Also, there is high risk of pulmonary complications like thromboembolism. Definitely it is seen more frequently, like 50% higher compared to the unilateral TKR. This is mainly because of the surgical intervention in both the extremities, which leads to more inflammation, prolonged duration of relative immobility. So it leads to the varicose triad, and it leads to the venous thrombosis, which leads to the pulmonary embolism. The conditions like uh, decreased return to the right side of the heart, it leads to impedance to venous return and increases the emboli debris, and this leads to the thromboembolism. Now the increased perioperative mortality, so it is almost 3 times more in case of single stage bilateral TKR, although it is very less, but it is more in case of single stage bilateral TKR. Now, the increased risk of post-operative confusion, again because of higher inflammation and fat debris embolization. The increase in wound infection rate. Now, this is interesting because the literature is divided in the wound infection rate. Some say because of increased operative time in the single stage bilateral TKR, there is higher risk of superficial and deep wound infection, while some authors say that because you are doing single knee, patient is having uncontrolled diabetes or some obesity, so wound infection or wound complication rates are higher in case of staged bilateral TKR. The literature is divided in that. Obviously, we need to give blood transfusion usually in case of bilateral TKR, and the rehab time is somewhat more in compared to the staged TKR or unilateral TKR. Now, what is supposed to be the optimum time between surgeries if you are doing stage TKR? On stage bilateral TKR, it is associated with the most favorable profile. Now, HSS guidelines for this is it should bilateral TKR single stage should be avoided in extreme age, should be avoided in American Society of Anesthesiologists ASA classification grade 3 or more, or if the patient is having comorbidities like pulmonary hypertension, heart failure, coronary artery disease, renal failure, neurological case, hepatic dysfunction, and coagulopathies. This is important. ASA 3, what are the criteria in that? Poorly controlled diabetes or hypertension, morbid obesity, active hepatitis, alcohol dependence or abuse, implanted pacemaker, reduction of ejection fraction, end stage renal disease, regularly undergoing dialysis, or history more than 3 months of MI,